Hello everyone, welcome to Tutor IMG's short medical series. So the topic we're going to be discussing today is basically peptic ulcer. And when we talk about peptic ulcer, our main concerns are usually about how to diagnose it, which test to use, and how to go about treating it. Now, peptic ulcer usually has a lifetime prevalence of about 10.4%. And it's equal in both sexes. The reason for the peptic ulcer disease is usually H. pylori. Now, with H. pylori, we need to treat the infection simply because we're worried that leaving it within the system can lead to the development of MALT, lymphoma. Now, what are the symptoms of a patient who has peptic ulcer disease? These patients will have upper abdominal discomfort. There will be nausea and vomiting. There will be bloating, flatulence, and of course, early satiety. The pain that these patients experience is chronic and recurrent. Now, because of this, sometimes we can have a differential of GERD, sort of cross, acting with the peptic ulcer disease. But if they do have prominent heartburn and acid regurg, then you need to assess for GERD first and move to peptic ulcer disease later. So having prominent heartburn and regurg make GERD more prominent. So watch out for these key phrases on the boards in order to help you move towards GERD as a correct diagnosis. Otherwise, the presence of these symptoms in a patient who's around 30s, third decade or fourth decade of life, without any alarm symptoms, please remember, we do not want to have any alarm symptoms. What are alarm symptoms in such a condition? The alarm symptoms will be vomiting, bleeding, or anemia, abdominal mass that is felt by the patient, weight loss, which is unexplained by any other, dietary restrictions, and of course, dysphagia. Now, these are alarm symptoms. Couple this with a family history of GI cancer or a previous long-standing history of peptic ulcer, and you have a very, very dangerous picture. Now, what are you supposed to do for this patient who's coming to you with symptoms that suggest not GERD, but gravitate more towards H. pylori peptic ulcer disease? If they seem especially anemic, right? Especially anemic, and you don't seem to have any other cause for that anemia, no vegetarian diet and no other kind of restrictions, then you do want to check FOBT, but this is only in a low-risk patient. Okay, remember, FOBT is not the kind of test that you opt for on the boards if the patient is high risk for a serious condition. It's only a test that you go for if they're low risk. But the most important test if you want to identify H. pylori is the urea breath test. Why is it so important? Because it's easy to do and patients can generally, there's a great reliability in this test. It is positive most of the time, very reliably in patients who have H. pylori. You can also do a blood test, but a urea breath test usually is very, very helpful in diagnosing this condition. Now, in our next video, we're going to explore the ways to treat this condition and also follow up with patients regarding this diagnosis. Thank you for joining us. Watch out for a part 2 of this video.